Oh, wow.
I think, Chris, we should be live just now.
Says we are
So
live on Facebook.
we should actually start our show. All
Eh,
right. All right, today is the 22nd of May, 2021. Again, thank you very much for joining us. You are with Dr. Nhlakanipo Kumede Talks Health and Healthcare Systems. In the past few shows, we covered hectic topics such as the role of managers in healthcare institutions, the role of traditional health practitioners in the modern society, but also we covered issues around artificial intelligence and machine learning in healthcare. In a bit, we actually did cover the health economics, or what they call the economics of health. And the last topic that we spoke about with Dr. Madela was the updates on the latest information around COVID-19. And we asked the public to come up with the questions that they asked, and we answered them during the show. The journey has been amazing so far, and we have indeed covered very few but very important topics in healthcare in this show. We have since received just suggestions on future topics that we need to cover, but we cannot forget that we are actually in the middle of the pandemic, and we need to always come back and talk about the issues around COVID-19. This is very important to us, and we would like to make sure that you come in and actually suggest more. There were some suggestions that suggested that we should actually talk about national health insurance in its bigger interpretation, so that people on the ground can actually understand what it is all about. And I promise that in the near future, I will be bringing somebody with serious knowledge on this topic that will come in and talk together with Mr. Chris Maxon, who's volunteered to form part of that discussion to talk about some of these issues. But most importantly, today I'm joined by Mr. Chris Maxon again. Chris actually joined DOH many years ago and trained as a clinical pathology, worked in Edenvale Hospital, in Kandla Hospital, and in some private labs, then subsequently returned back to the Department of Health. He also worked in the communications department and also as a spokesperson for the department. He now works in programs interested in topics like HIV and AIDS, TB, mother and child, and has a significant management background. He now holds a master's in development finance. Chris has also written many articles in various issues and recently shared with us an article on some of the lessons learned during the COVID-19 pandemic in South Africa. Chris, good morning. It's nice to have you again. Please greet our listeners.
Good morning on a Saturday morning. Once again, we are here under the pandemic, hoping everyone is safe. The cases are increasing, and we must be concerned and cautious.
Thank you very much, Chris. Welcome again to this show. But if you may, I think that today I will attempt just to provide a little bit of information around the issues concerning COVID-19 vaccine. As you know, that South Africa has actually embarked on rolling out its COVID-19 vaccine strategies. And would like just to give our viewers and listeners a little bit of information around that issue, because I thought this was very, very, very important. And I'll be sharing this information, obviously, based on my personal experience, having worked in the vaccination sites and what I've actually seen during phase 1A of vaccination. And now that we've combined phase 1B and phase 2 of vaccination rollout in South Africa. We all are aware that South Africa has joined the world, starting with the vaccination of staff and the community with COVID-19 vaccine. And we know that the particular focus was obviously to vaccinate healthcare workers first on phase 1A and phase 1B. And then phase 2 will then go on and vaccinate the actual general public. And since South Africa has done that, actually in phase 2, we started in the past few weeks to vaccinate all the old age citizens over the age of 60. While we appreciate this progress, our vaccination centers are still not receiving the numbers that we would like to actually receive on a daily basis. And based on the experience that I have, I think that this may be caused by the lack of support by the younger people towards the older people at home, teaching them how to actually register to vaccinate, and also making sure that they send them to these vaccination sites, as they would always need some aids to actually get them. Now, we know that this is actually a big undertaking by government, but it is important to provide the information that for us to be able to actually get into the herd immunity, we need about 40 million people in this country actually vaccinated. And this is the start of actually getting freedom of COVID-19 in the near future. While South Africa has successfully commenced now rolling out Pfizer vaccine, it is important to note that unlike the J&J vaccine that we actually rolled out in phase 1B, Pfizer vaccine is actually a double dose vaccine, which means that after receiving the first dose, you actually need to come back within 42 days to actually receive your second dose. It is important to also highlight that the previous recommendation actually suggested that within the 3 to 4 weeks, you need to come back. But the latest data that we have actually provides the fact that you need to come back at least in the next 42 days after you've received your first dose for your second dose of the Pfizer vaccine. Now, while many people are skeptical about the vaccines, it is very important for us to know that vaccines have been with us for a long time and has contributed in decreasing morbidity and mortality in the world. This has been proven in the scientific studies. So my expectation would be that the young people who have easy hands need to help the older generation to enroll to get vaccinated at their nearest vaccination centers. And they can do this by accessing the web link. It's www.vaccine.enroll.health.gov.za. And this is the only way that we'll be able to achieve our herd immunity. But it is important also to stress that vaccines alone cannot prevent people from getting infected. Vaccines cannot entirely prevent people from getting infected, but it does prevent a certain number or a certain portion or percentage of people. But most importantly, it will prevent people who might need them to actually get into our institutions and get admitted and require serious management of COVID-19 disease. But obviously today, let's talk about the lessons. Since 2020, we've been battling in South Africa since the first case of COVID-19. And today I'm inviting Chris to actually talk to us about the lessons that have been learned from the pandemic of COVID-19 in the Southern Africa. And again, I welcome you to listen to this. Chris, take us through. What do you think are the actual lessons that we have learned in South Africa on COVID-19 pandemic?
Well, one of the lessons that we have learned, and unfortunately, it's something that we should have learned a long time ago. You'll remember that when HIV and AIDS came into the country, we were in the process of transforming the healthcare system. Again, now coronavirus enters the scene right as we start to implement the national health insurance. So the first lesson is we need to be ensured that having a health system that is resilient, it simply means two things. You are able to respond to the urgent emergency of the moment, but also continue to deliver the services as normal. Sadly, what we have seen is that everything shut down. Children were no longer immunized. People could not go and test. People were not sure whether to go and take their medicines, whether it's for hypertension, TB, HIV, and mental health. So that stopped the system. So I think part of the things that we need to do is to ensure that our system can continue, even if we have got an emergency that we need to respond to, and be able to deliver what it needs to deliver continuously without any interruption. Currently, we will have a big challenge of having to mop up children that were born that have to be immunized. So children born after April, I guess they're not immunized, or a good majority are not immunized. Imagine having to go back. But also we had an opportunity then that as we went to families, it's something that we could have done during that time. So one of the things is to ensure that we integrate, to build a resilient system and ensure, but critically, we need to build a leadership cadre. One of the things is that it has exposed our weaknesses as well as our strength. I think we need to begin to build a leadership cadre that is able to lead the health sector. I mean, many authors have said that we have got a health leadership crisis in South Africa for a number of reasons. One of them is this belief that you must have a clinical background to manage how much? 30 billion or so per annum. I wonder, clinical work, how does it help you to manage finances? So we need to begin to define what are the core competencies that a leader needs to be able to manage a health, and define that health is not only at head office, it's also at the smallest unit, which is a clinic.
Precisely.
We need to bring people at the lowest level at clinics. And I must say, one of the sad things that I've realized is that those people at lower levels were demobilized because a lot of decision became centralized. But healthcare, as a multi-sectoral system, you need to devolve leadership at all and various levels of its system. So it means leadership cannot only be located at province or national or district. It must be located even where we are. So that requires that we begin to define how do we attract, how do we develop, and how do we maintain those people. But another key lesson that for me that became important is this thing that we need to focus on the population.
Yeah.
And COVID gave us very good example. Right now, you were teaching us that we can now discern what we need to do, when, and to who. Right now, we are rolling out vaccination to the elderly because we realize that they are most at risk. So then the younger population can at least resist diseases because the older population have got other diseases. So if we can do that, why are we not doing that for general health? Yeah. Interestingly, by the way, I think where you used to work, what is called a community-oriented primary health care was initiated in Polela.
Correct.
Yeah, in KZN. So what have we lost? Why have we not moved that way? Why are we waiting for people to come to our clinics before? Why are we not going there and be interested in saying, in this ward, live so and so, they have a medical aid, this is the doctor they attend, and these are the diseases they have, or they are healthy, or they perceive themselves to be healthy. And those are things that I think one of the key lessons that we need to do. And otherwise, we shouldn't be having such a high burden of TB because we now know we have the capacity, we have the skills, and we have the resources to go to each and every household and check people who have got TB. And it is my view that in 1 year, we would know in South Africa who has TB, who has defaulted in treatment, who must get on treatment, and which treatment each person gets, which helps us in terms of budgeting, which helps us in terms of planning for ahead, and therefore which help the whole system to be able to anticipate what things are going to come. But it also builds strength in the system for future epidemics that might come. Yeah. Another critical area that I think was important is the use of technology. For the first time, we could use technology to trace people, to know which Tlhaganipho and Chris met, and Chris tested positive, so we must go back to Tlhaganipho and check because it's a contact case. So the use of technology for decision making has been somewhat a revelation, but it's always there. South Africa is regarded as a middle income country. We should be far in terms of technology. The sad story is the last I have of an IT strategy in the Department of Health. It expired in 2016. Oh. I never heard of it anymore. And we don't have a strategy that we need to. I would assume that we not. Or neither do I believe we have a political will to modernize and digitize the delivery of healthcare. Precisely. Because what you have seen is people love to interact through their handsets or their laptops and interact with doctors. Yeah. And I make a point that Dubai, for an example, have got a 24-hour app where people can just go in, set up an appointment and talk to their doctors, which will reduce the number of people going to our facilities. And by the way, South African median population is 26 years old. These are young people. If they want information, they use technology.
Precisely.
And Dr. Google has become famous simply because that space, there is a vacuum in that space. And so that is one of the areas that I think has been critical. But another area is the use of data. I know I always say in my department that people like to say data, use data for decision making. But that is not, it's something that just doesn't come because you said so, or because there is a form. Actually, just giving people forms to fill, you might have malicious compliance. You need to have a data management strategy first and build a data culture within the system so that it becomes part of the organizational system, that data is important for us. Make it meaningful for each and every person. That data is important for you because you can measure yourself, how well you have done. And when you do your performance assessment, you can say and give figures so that you can give yourself that 4 or that 5 that you must motivate for when you write.
Precisely.
And critically for me, that becomes very important. And then we need also to ensure that we innovate in our approaches. I think we are too comfortable that because we know things have been done this way, so they will always be done that way. We seem to be shy for innovation. We have seen how the integration between public and private happened. That's an innovation. That now people can go anywhere, that you can register within one system, whether you have a medical aid or not, that system will tell you where you must go. So that's an innovation for me, and actually a building block towards universal healthcare that we must exploit. And I think it's a strength, it's going to be a strength from which we must build rather than building from weaknesses. And the other thing, then the last thing is to ensure that we use efficiency and effectiveness. Efficiency and effectiveness are not just buzzwords. A person, I think we've spoken when we spoke about the health economics, that it must be drilled at the lowest level. At the lowest level, that, as I say, at the clinic, you must know what you are doing, how much it costs, and you must know the balance, that you use the little for maximum benefit, the 80-20 Pareto principle that people talk about, and the effectiveness, and to who is it going to the right person that it was designed for. And that will build a very strong system. But all of these lessons should be grounded on a very great leadership. That unless you have a strong leadership in health, you are not going to achieve all these things. And strong leadership and organization that succeed are organizations that focus on building a strong performing culture, building an infrastructure that ensures that people get what they need at it when they need it. Not this thing that I cannot do it because I don't have e-globe or e-battery of a certain machine is finished, so I can't check a patient. Change the way of doing things. I mean, honestly, do we still have to fill papers to apply for leave? I mean, at this day and age, do you have to fill a Z83? Honestly, at this day and age, in this are we on the 4th or 5th IT revolution? And we need to change the way we do things. And the other thing is we need to build strong teams. Not the silo mentality must be broken. And that can only happen by ensuring that every delivery happens in an integrated fashion. And lastly, we need to begin to appreciate the people that we work for and work with. Ensure that people, when they come to work, they feel appreciated. The way we talk to them, just giving them a tap at the back of their hands, not only responding when there are problems, not coming to people to resolve crises, And that, for me, those are organizations that perform excellently. And those are the 4 things that they focus on. And those 4 things rely on having strong leadership. I think those are key lessons for me. If I hope I didn't take long.
No. I think that you've actually highlighted on very important issues, actually, that we actually have. One would assume that we have learned this, because obviously, I mean, these are the lessons that we should have learned. And one, then you talk about something very interesting about leadership. And leadership, part of it is to actually recognize what you need to learn from, because there might be many lessons. And the difficult part is to actually identify the lessons out of everything that actually happens in our communities. And I so wish that at some point we can get into a stage where when there's a problem, we can actually look at it as something that already before anything happens, let's make notes, because in this journey, we are going to learn something. Let's take notes as we go along, so that once we finish this, we can always go back and look at these issues and start developing plans to actually solve the problems. But it is quite interesting that among other things that you say we should learn are the things that we already know. And these are some of the things like our community-oriented primary care that is embedded in our very own country. You remember the history of Emily and Sidney Clark in Polela, where they actually pioneered this. And they even wrote a book from Polela to Jerusalem, trying to highlight some of the dynamics of primary health care and how the community is engaged, and how actually going into these underserved areas can actually influence how much of health can actually get into these places where it's not very easy to get, and how much the use of multi-stakeholder engagement within our societies can actually impact on the social determinants of health. And I think for me, these are some of the issues that I think we could learn from, and that we can actually go back and tap from the actual primary health care and start developing from there and go forward from this. But it was quite interesting, Chris, that you mentioned that you've already seen how national health insurance is going to happen, because we've already actually had a private-public private partnership actually seen happening live during the pandemic and the vaccination rollout, because you have a system where anybody can go into a private facility or a public facility, it doesn't matter where they work, and actually get a shot, and they registered within one system. And I thought that that was really interesting to actually note that we are actually in the era where we are already trialing some of the things that we think and we hope that NHI is actually going to bring as we actually go ahead with it in the next few years, as it's going to formally kick in our country.
Yeah, that's true. But you see, the problem with the issue, the crux of learning is 2 things. It's not just absorbing, it's also changing your perspective and also doing. That really is what learning comes. If you want to see if a person has learned, is that they change their perspective, not totally change, or they what would I say, they adapt their perspective to the current realities and implement things in the new learnings that they've done. And that's where we are going to see if we have learned anything out of the crisis.
Yeah.
The sad things, if not learned, we're just going to go on and on and on and on, hoping that we are going to make any change, and certainly we won't.
But I mean, Chris, you spoke about moving from the paper-based system into a computer-based system. I mean, how much more should we wait for a digitalized system in our country, when we've moved from the 4th industrial revolution already, and now in the 5th industrial revolution? What seems to be the issues for us to actually fully embrace this? Is it because of the resources? Is it because maybe we don't trust the IT system in itself to actually keep our information safe? What seems to be the issues around that field that we're taking very slow?
See, we are now touching on a bigger topic, because for me, it's the issue of prioritization. That's one. And secondly, if we really wanted to prioritize this, we could have cut in many areas and focus it on it, do it, and get it gone, because I'm sure the biggest cost will be the initial cost. Maintaining it will just be self-relying, because it also means if we're really crying about, do we have the necessary funds needed now? I think we do, because you need to check up our revenue collections and hospitals. This belief that anyone can go to a public hospital and not pay should stop. Those who can afford to pay must pay. And then we need to build that culture so that that revenue can then cross-subsidize and add to the public purse that is already there. But also, I think, is this thing of, what do I want to say? The schism between private and public, the private sector and public sector. We have created this mentality that public sector is a no-go area for public sector, for private sector, and business in particular.
Yeah.
There are new models of healthcare funding that we need to try and build into this. And this discussion, I remember as many years as in the 90s. With
Sure.
How do you build in your hospital, for an example, in the private wards where medical aid patients can go and pay, so that they don't have to go very far from home. They can be treated near their home and get the very necessary care. Because the truth is, it's doctors who work at Itindale who treat those patients at the Itindale private hospital. It's and there's no doctor in South Africa who was trained by private university anyway. All doctors are trained in the public side. It's doctors at Grace. So we need to break that wall and tell business that there are opportunities for you to invest here. And these are the areas so that we can work together. That will bring in more funding, and that will help us to check out. And the most important thing is what we call is having a vision. Do we have a vision for it? And health is about disease. And certainly the last one is that we've only thought of health as disease, and anything else should focus on disease. And that's another problem, that one of the things that we must unlearn from COVID-19 is to treat the response as about managing patients and forget about building a system. Because if we do that, we will kill the very best that we have through this process. And therefore, we need to bring in new models of funding and new ways of doing things so that we can build a resilient system for the future, and especially for the universal healthcare coverage. And I think that's why we move towards that mentality. I think we'll get it there. And solutions are already in the market. I mean, I don't think we need to start from scratch, ask people to write new programs, new application. These things are already in the market here in South Africa.
Yeah. So Chris, what happens if we don't learn anything from this?
Two things. The cost of healthcare is going to rise drastically. Secondly, given our poor economic status, we are not going to afford public healthcare. And certainly, some of the things that are already provided for free will need to be cut back. Things like free pregnant women attending clinics for free. I think that in the near future, government will have to say, no, people must pay. Children under 6, some of those decisions we might have to reverse. We might have to cut down on the employment of staff. Actually, it means universal healthcare coverage will not be realized, and the health of people will deteriorate. It will be as if we have never treated HIV. You remember the days when we were burying almost every day, not even the days, just last year, we saw the devastation of COVID, where a family will lose someone today, 2 days later, while they are planning for their funeral, a father dies on Tuesday, on Thursday, the mother dies, on Saturday, the grandfather dies. I mean, those kinds of things will happen, and our children will not grow. Certainly, we won't have South Africa. So the security of the country is really dependent on this. That's why health is now seen not just as a health issue, but as a developmental issue.
Yeah. So obviously, Chris, this means that we are sitting on a time bomb where if we don't do anything about the information that we already have, the time is running out, and we are going to find ourselves in more trouble trying to contain this spread of fire that is now uncontrollable, when now at least we can still grab some things and actually put them into perspective.
That's true. If you remember very well, let's be realistic. Let's talk about now. Yeah. Right now, we are right on the edge of a third wave. As we start our vaccine rollout in earnest, what you are going to see is cases are rising, new cases are rising. And by the way, I just heard somewhere that they are now seeing a lot of these cases as younger kids that were seen earlier in the start of the pandemic as not being that much at risk. Now we are seeing them in schools. They are happening in schools. And as it is, the current vaccines are still being tested, their efficacy in children. So that is one of the crises that we are going to see. The second problem, there's a study I was reading. HIV testing has regressed by 47%.
That's a serious
People on
concern.
treatment has regressed by 67%. What that means is we might have another pandemic of a resistant HIV. The third pandemic another pandemic we might have is the one on TB, resistant, multi-drug resistant TB and extreme drug resistant TB, because people have not been taking treatment. And another one is mental health. We saw the rise of mental health cases during the pandemic as people failed to cope. So all these are going to bring a strain, not just on the health system, but on the public purse. And we, as a country, we will soon not be able to afford the healthcare. And once that happens, the whole country will be deep. We will need to cut corners in certain areas. And some of those areas will largely be on health. And certainly now, healthcare, whether you live or die, will depend on how much you have in the bank or whether or not you have a medical aid. So that's how sad the situation might be. And that's just my view. Somebody else might disagree with me. But I think the way we are doing it, ignoring HIV, ignoring mental health, ignoring TB, we are definitely pushing the can just down the road, so that by December this year, all these things will erupt and we'll find ourselves right in the middle of a fire that we will not be able to control.
Yeah, that's quite really, it's frightening to actually realize that we have so much that we actually need to do, and how much we should actually learn from whatever that is going on, and actually not to then forget about the things that we had put in place to be able to control the chronic diseases that we have and the infectious diseases of the past, and that are still actually within our midst and that have not been entirely controlled, that we have a probability of regressing all these things that we've already achieved. And that is a very scary thought. But how do we then synchronize this and ensure that we don't lose what we've already achieved over something that is happening now? And then once we control these, come back later to solve the cracks that we would have created in the past.
One of the biggest problems of having or run flat in a car is that you can just continue driving until you find a garage, you know. But if you don't have a run flat, you know you must stop and get help. I think that is what you need to do. And Mandela did say, after climbing mountains, at a certain point, you must stop and look back how far we've come. That is what we need to do. That's the first thing that we need to do. How far we've come, what are the lessons that we have learned, what are we taking forward? The second thing is we already have created good partnerships around us. So we need to build those partnerships. But the critical partner that we have left out so far is the communities. Yeah. We can't treat them just as patients. They are a key stakeholder. We need to bring them on board to say, here we are. This is how far we've come. These are the lessons that we have learned. And when we are together there, we must define what is the future that we want. Define the future that we want and develop a way, how do we move from here to that future?
Yeah.
And build, and then that would mean, and building systems of what will help us to get there. And it's not always about money. You see, in South Africa, we'd like to reduce everything to, hey, we don't have the money, we don't have the money. We must look at, do we have the capacity? What are the capacities that we have built over the years? And where can we tap on them? Because the future will only, as we have learned, that the future is multi-stakeholder and multidisciplinary.
Yeah.
That future, what role? You see, for now, I had someone telling me that, oh, Koko in Guamashu, they are scared. They don't understand why the first dose and the second jab, then the second dose. No, so which shows our communication is somewhat lacking. So we need journalists to come on board to say, defining a future that we want, they also have got a role to play. And that we did when we responded to HIV some years ago. And then create a vision that is owned by everyone that will take us forward. And that is all that we need. We can't go on as if we have run flat in the car. And so when we meet at the garage, because the garage, we will find all these other epidemics waiting for us.
Yeah, definitely. I think that, you know, what will happen if you do that, potentially, if you're running and you're driving on a run flat, is that when you get into the garage, you actually, when you get there, the rim in itself is already also buggered up. So if you need to change, you're not going to only change the tire, but you also then need to change the rim in itself.
And figuratively, the rim, you will find that you don't have a health system anymore.
Exactly.
Yeah, that's true.
And that is really crazy. Now, you know, when you talk about Abokoko having this narrative that they're afraid of doing this and that, and people actually spreading misinformation about COVID-19 vaccines throughout in our communities, especially on social media. I was talking to somebody the other day, and my argument was that the issues around information sharing is that the misinformation, or those people that actually share the false information, they identify a space between the people that that communicate the correct information with the public. Once they see that there's no consistency somewhere there, they fit in, and where there's a gap, they actually put in their own narrative so that people can consume that. And when you come back to try and do and control the damage that has been caused, already that narrative is actually going on, which means that we need to be consistent with how we provide information, and not to forget to actually provide the accurate information and from the accurate sources of information that we have, because otherwise we leave a gap. These people actually take over, and everybody is then scared of actually getting vaccinated because somebody somewhere in the corner of the world thinks that if you vaccinate with Pfizer, there will be a chip coming out from the point where your needle goes into your flesh.
Yeah, that's true. But it's also a human nature. I mean, we all want to belong. We all want to be seen, to be, expert in one area or another. Because otherwise, if we don't do that, we find ourselves lonely, and loneliness is equated to fear. That being lonely means I'm not all right upstairs. It means there's something wrong with me. It means I'm antisocial. But loneliness is also an opportunity for you to have time for yourself, to reflect on yourself and to digest all this information that comes towards you, and to make choices, the right choices, that in this context, I choose the right side to give out the right information. And really using your phone, helping Ukoko to register, or taking that 5 minutes to take Ukoko to the nearest site, because I understand that I've seen many sites where they say, no, it's fine. If Ukoko is not registered, bring her here, we'll register here Correct. On site, and also on do the vaccination on site. So people can use, you're saying, no, but Ukoko does not have a smartphone or this or that, because you can do it as just a duty for your country and for your community to say, I will take Ukoko for, drop them off and bring them back home, and buy them tea, by the way, buy them tea and bring them back home. And that will make you sleep better at night.
Precisely. I mean, you are talking about something like that. And not so long ago, actually yesterday, I was thinking, maybe one day I need to take my laptop, go into like where gogos go, where they get money, umholo or whatnot, and things like that, and just sit there and have a target on a day. Say I want to get 200 gogos actually registered and register them myself, so that they can actually then go and get vaccinated. And I thought to myself, if we've got 10 people who are able to do that already, we've got 2,000 people that have registered. So it's quite not very something that is, very difficult to actually do this type of things.
But it's as simple as exactly as you put it. You just say to yourself, guys, here at Itindale Hospital in our site, from this time, let's say from 2 o'clock to 4 o'clock, the nearest pay point will take those gogos with our transport and bring them here so that before they go home, we ensure that they are vaccinated.
Yeah.
So it's as simple as that, and it doesn't need a submission. It doesn't need higher authority, and that's what I was saying. Leadership should exist in every structure of the health system, and each one of us must not just look at the titles that we have, but we must play a role of being followers who are leading.
Yeah. Yeah, that's a quite interesting, definition. You say that we need to be the followers, but the followers who are leading. That's an interesting topic right there.
It's a concept. It's called a follower leader, or some people will say leading from behind. I think it's something that really we need to appreciate. Yeah. And this fixation of wanting to be seen in front is what causes us a lot of problems. That sometimes we go to the front, we forget people at the back who have got the information that we need, because information is power, and we leave them behind. So they look at you, they are wielding their power, looking at you, making yourself stupid, and then you embarrass yourself in public. And whereas those who lead from behind will just give you information and say, no, I think this is what you need to do here. But if you care to listen, I think this is what you do here. This is what you do here. See, one of the biggest problems is that a lot of us in the health system, especially in the public sector, I think also in the private sector as well, we have just taken a back seat to say, let me watch. Maybe when they need me, they will call me. Yeah. We don't want to play that follower leader role and say, okay, let me play my role from the background and do what is needed to be done. And I think what has happened currently, that has been done. The people who have gone out, I happen to support a eThekwini. I've seen people going out. We were visiting pension points, distributing, educating gogos to say, this is what you need to do, gogo. If you need this, this is what we use our phones to register them. So at eThekwini, I know for a fact, people have been accepting people who are not registered. So part of what has been happening is that at the point when they enter, somebody is there with the form registering them there. So they are queuing not to register, they are just queuing to go in. So the nurse inside is not worried whether this person is registered. They are just injecting them because somebody is taking care of them. And as I was talking about technology, tablets, I'm sure one of these big companies can offer, whether it's MTN, Cell C, or Virgin, if it's still there, they can offer tablets and say, we are helping you. You use these tablets, somebody standing at the door, punching them, registering people, and it uploads same time you have a register for that people. By the way, once you have registered all these 52 million people, what are we going to do in the future with that information? Because that's the information that can help us to plan for the future. But have we thought about it in that way?
Yeah, that's quite interesting. That's quite interesting because, I mean, we are collecting data there, and data is a very important tool to shape how we want to go forward, and we can actually use this data in the future for something else. But I think it requires people that think beyond, that have got that mentality to see the future and to know that we can actually keep this data safe and it is accessible and it can be used for something greater. I don't want to spoil. Come through, Chris.
No, I was just saying private companies are going to use it, and when we need it, they will sell it to us.
And that is problematic.
Yeah, because the people who are sending us all these SMSs offering you insurance, That's how they collect the information.
Yeah, hey.
Yeah, easily. When you go and register in a building, register your name, they take those numbers. That's their database. It's their possession. And to use it in future, you have to buy it from them.
Sure. I think we've got a lot of homework to actually do to find out exactly who's the custodian of this data and start securing it from now and know that we have a space for it to be actually be used in the near future.
And those are the strengths I'm saying we can start building on, because and that population approach can start there, because we now know we can use that data so that we can geolocate people's addresses, and we can go to each and every home. And so we now know, oh, Gogo, sorry, so this 5 million population of Gogos in KZN alone, we now can geolocate where they stay and can know what they suffer from, what treatment, and we can expand it, what treatment they take, if they take any, and where do they get their pension, and use it for health planning.
Yeah, that's quite interesting. And I don't want us to, because, you know, all of these topics that we are touching are topics that can take us like years to actually unpack and to discuss, because the topic actually brings another topic on it. And then we talk about various issues. And that's why I think that we've resolved to actually call this show healthcare systems, because that's what it is. Everything is just interlinked, and it cannot be that we work in isolation. We need to understand that there's a clinician, but also there's an IT specialist, but also there's an artisan foreman in the production in itself of healthcare services. And all of these people, if they don't work together and in synchrony, then, you know, they destabilize the whole system. If you do not have water in the institution, it's not dependent on a nurse not to have water, but somebody needs to take that responsibility. And if they don't see themselves as a very important a part of this chain of production, then it becomes a mess. And I think this is a proof in itself that, you know, we talk about COVID-19, but now we realize that everything is actually interconnected, and we need to appreciate those type of things. So before we close, I think that the time is actually running. It's actually 9:55 right now. And I wish to thank you for forming part of the conversation today to talk about the lessons that we've learned from the COVID-19 here in the Southern Africa. So if you do have any other thing that you would like to communicate to our viewers, please do so now.
Thanks. I hope that we are in the process of responding, building learning organization, documenting all these lessons, and most importantly, not losing sight of the future, which means we want to build universal healthcare in South Africa. So this is an opportunity to start, because we already have elements of it. And now we need to build momentum towards it and capacity for managing it. And that should start at the lowest level of care. And all that needs competent leaders that have got a shared vision that will build an organization of excellence, of performance, and that appreciates the workforce that works with it and work with them. And for me, I don't think anything can be beyond us. We can do it. We've built partnerships. We have been doing it for years. And I think the time is it's not today, but it was yesterday.
Yeah, thank you very much for your time this morning. And again, this is Dr. Nhlakanipho Gumede Talks Health and Healthcare Systems. And again, we have brought you some of the discussions and in conversation with Mr. Chris Maxon, talking about the lessons of COVID-19 as a pandemic. Just remember that you can actually access some of these recordings in my YouTube channel again, and you can always get and listen to the chats that we have in this show. Chris, thank you very much for joining us, and we'd like to call it a quit for today.
All right.
Void.